Hey, are you on Social Security disability and you've gotten Medicare? Now you're wondering what benefits you should go with, a Medicare Advantage or a Medicare supplement? Well, I've got the answers for you. My name is Mark Garrett. I'm the owner at National Senior Savings. Stay tuned. Hey, once again, I'm Mark Garrett, owner at National Senior Savings. What I'm bringing you today is Medicare disability, all you need to know. So really, these are the basics that I'm going to throw out to you. I get a lot of calls. I would say 30% of my calls are from people that are on disability and they're wanting to get a Medicare supplement plan. And unfortunately, in most cases, I can't help them. And now I'm going to kind of explain why it's difficult to get a Medicare supplement for somebody that is on disability. So who qualifies for Medicare on disability? That's the first question. So if you've been on SSDI for 2 years, that's Social Security Disability Income, for 2 years or 24 months, you should automatically qualify for Medicare at that time, no matter what your age. I have clients as young as in their 20s and 30s, all the way up to their 60s that are on SSDI, and they get Medicare because of that. If you're on SSI, not SSDI, but SSI, which sometimes if you call up Social Security, they'll tell you it's another name for welfare. SSI is. SSI, you will most likely not qualify until you're 65 years of age. I'm not saying in every case, because I've seen some really strange things in all the years I've been dealing with this, but in the majority of cases, you're not going to get disability income SSI Medicare. You're just not going to, which I know is frustrating, but that's just the facts. What type of insurance can you get once you have Medicare and you've earned it by being on SSDI and you're under 65? So more than likely, if you're on SSI disability and you're under 65, that means Medicare supplements are most likely out of the picture for you. So in some states, companies do offer Medicare supplements to people under 65, and in some states they don't even offer supplements to people under 65. In the states that do offer them to people under 65, they usually cost 2 to 3 times the premium of what someone's 65-year-old would pay. And the reason being is because these insurance companies that are saying, hey, you pay us monthly and we'll pay everything that Medicare doesn't pay, like in a Plan F Medicare supplement, they know that by you being under 65 and being on Medicare, you're on disability, and that you probably have a lot of health conditions going on, and they're not going to take on that responsibility because it's a lose-lose situation for them, in other words. So really, the most important thing that you need to keep in the back of your mind is, depending on what your age is, at 65, everybody gets a free shot at Medicare supplements. And it doesn't matter if you've been on disability before. At 65, you'll get to sign up just like every other Joe in America who's signing up on their 65th birthday without any medical questions and without any increase in premium over someone else who's 65. So good news, bad news there. You do have the option of Medicare Part A and Part B with a Part D prescription drug plan, and that is the best plan for someone on disability that wants to have a lot of control over their own health care. So if you're someone that's on disability and you plan on traveling, if you're someone on disability and you don't want any networks of physicians, you want to be able to pick up the phone and go to who you want to, when you want to, Original Medicare Part A and Part B with a prescription drug plan is going to be the choice for you. Now, there's many people on Medicare disability who choose a Medicare Advantage plan. And depending on the area you live in, if it's more rural or if it's more urban, that may or may not be a good thing. So there are some good PPO plans out there that have bigger networks than an HMO does with a Medicare Advantage. And someone that's on disability can choose one of those plans. And if you're in a big city like Dallas or Chicago or Miami or Atlanta or Phoenix, one of the big cities, usually you have a larger network of hospitals and doctors to choose from, more so than someone who lives in a rural area. Can you get extra help? So I get this question a lot from people. Hey, if I get a Medicare supplement and they're on disability, am I still going to have to pay that $134 a month premium for Part B, or am I just going to pay for the Medicare supplement? Well, I think we already answered the Medicare supplement question. If you're under 65, it's probably not going to be the route for you to go. But let me go back to the $134 premium. It all depends on your income and your assets. If you qualify for Medicaid in your state, you might be able to get your monthly Part B premium of $134 in 2018 paid for you by the state and federal government. That means on your Social Security check, you would see that money come back to you rather than being deducted from you. You might also qualify for the Medicare Savings Program, which will usually pay the premium for your Part D prescription drug plan, and it's also going to reduce the cost on your medication significantly. So clients of mine that get the extra help and they're on the Medicare Savings Program and they're categorized as LIS, which is a low income subsidy. There's 4 levels and there's 25 through 100% per level. I'm not going to get into that right now. I'm just letting you know that those people not only get their premiums paid for their Part D, but their costs for medications are usually like $0 or $3.30, or even for the most expensive medications, they pay $8.25, where someone else who just has regular Part D may pay $50, $100 or more for that same prescription. So there is extra help out there for you. You have to apply through your state. I always recommend to you that you give it a try if you're on the borderline with your income. So how do you get the financial help? And that's kind of what I was addressing there. You go to your state's Medicaid website. So if you were able to see my video today, more than likely you have internet access, and you can go to Google or you can go to Bing, both wonderful platforms, by the way. Google and Bing, you can type in Oklahoma Medicaid offices, or you can type in North Dakota Medicaid offices, or North Carolina, or whatever state you might live in, and it'll pop up. And usually when you get there, there's an electronic application that you're going to need some information like your social and your Medicare number and how much you pay in rent and how much your Social Security check is. These questions they're going to ask you, and when they ask you these questions, answer them as truthfully as you can, and they'll come back and tell you exactly what you qualify for. If they on your website for Medicaid don't have the Medicare Savings Program, type that into Google, Medicare Savings Program, and the federal government does have a link that you can go to apply for the Medicare Savings Program to help offset those drug costs. So I get asked a question a lot from people, can you help me out with applying for Medicaid? And my simple answer is no. I do not assist people in applying for Medicaid. Although I don't mind answering questions, I don't get compensated for Medicaid applications, and it's very time consuming to sit down and fill an application out, somewhere in the neighborhood of 30 minutes to an hour to get all that information in and get it sent off. And due to that, I don't have the time to do that for everybody. I have a few people in my local area over the years that I've helped out, and I do a little bit of volunteer work, but as far as my business, National Senior Savings, on a national level goes, I'm more than happy to answer questions for you and guide you in the right direction. I just can't do the application for you myself. You're going to be the one that's going to have to do the legwork there. Now, once you do, if you find out that you're going to get that $134 a month back, give me a call, because I have some special plans designed specifically for you if you qualify for that extra help from the government. So once again, my name is Mark Garrett. I'm the owner at National Senior Savings. If you like this video, you found it helpful, please like it, share it, subscribe to my channel. Call us at 800-708-5810. Thank you very much, and hey, have a great year.